Okay, I'd like to welcome everybody to the August 2nd Board of Health meeting for the town of Chatham. Please note that this meeting is being recorded and will be available shortly thereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify myself. Pursuant to Governor Baker's June 16th, 2021 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of his March 12, 2020 order suspending certain provisions of the open meeting law, GL Chapter 30A 20 until April 1st, 2022. This meeting of the Chatham Board of Health is being conducted in person and via remote for public participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 1-508-945-4410, conference ID 1335-543-92 #, or join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of the agenda item discussions. My name is John Beckley. I'm the chair of the Board of Health, and let's start the meeting. We have two hearings tonight, followed by two discussion topics, so four items total. The first hearing is a continued variance hearing and approval of IA technology for Cheryl Acton at 24 Salt Pond Road. Coastal Engineering is the engineering firm representing the application. Do we have somebody from Coastal Engineering on the call?
Good afternoon. This is Sean Riley, Coastal Engineering, representing the applicant.
Okay, Sean, very good.
Yes, so there is an existing structure out there that has a 4-bedroom septic system in place now, septic tank, pump chamber, and field that is currently outside of the 100-foot buffer. The house is to be raised and replaced with a new 4-bedroom dwelling that's to be pushed back further from the resource area. The proposal before you also includes the addition of some living space over the garage, and that's the reason we're here before you, is to, they recognize that space above the garage does represent a bedroom by the definition. There isn't any intended use of it now as a bedroom, but to accommodate that, we're here before you for a variance for the additional bedroom. The lot size is not sized to accommodate. It does not have the 50,000 square feet required for the 5 bedrooms. So we're proposing IA technology, and we're proposing a 0.75 microfast unit. And we're also proposing a pressure distribution system that is to be located outside of the flood zone, beyond the flood zone boundary, and also beyond the 100-foot buffer to any of the resource areas. We're seeking a variance for the additional bedroom over the number allowed by sections 5.1 and 5.2 with the use of innovative alternative nitrogen reducing technology. And we're removing any of the tanks that were within the 50 and 100-foot buffer to the resource area. We'll be removing the existing soil absorption system that is currently within the driveway and also within the footprint of where we're proposing the pressure distribution system. There will be a reduction in nitrogen loading with the addition of this IA technology, even more so than the 4-bedroom predecessor. So with that, I'll open it up to any questions you may have.
Okay, board members, anybody have questions or comments for Mr. Riley? It's fairly straightforward, I would say. We do have a recommendation from Judy, the health agent, that she supports the application. However, she has recommended 10 different conditions associated with such an approval. Questions for the applicant
Yeah.
about the design? Go ahead, Noble.
Noble, I had one question. On the first floor in the den home office, it's a archway, but how wide is that? It doesn't say. It looks like it's pretty wide, actually.
Yeah, it's more than 5 feet, the 5-foot requirement.
Okay, thank you.
Question, Ron Broman.
Go ahead, Ron.
The existing leaching chambers, have they been checked, or is that something they should do before we approve it?
Yeah, so the existing leaching chambers, we were going to utilize those in the previous design. With this new design, they'll be removed. The stone will be removed, and any of the surrounding contaminated soil within that area will also be removed. So none of that infrastructure is to be utilized. It's a whole new system with pressure distribution pipes and stone.
Thank you.
Okay, thank you. Any other Board of Health comments or questions? If not, can I get a motion on the table to approve? Okay, we have a motion from Ed to approve. Can I get a second?
Second, Tom Broman.
Could I ask Judy to read the conditions that would be with this approval?
Yeah, the first one on your memo is incorrect. So that's, I think, why Ron mentioned the leaching chambers should be in good working order.
You want to renumber them then, or?
Yeah, so number one,
Is
we're going to
deleted.
delete. And then we'll go on from there. The applicant should restrict this property to a maximum of 5 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and/or Board of Water and Sewer Commissioners, directs the connection of this property to the municipal sewer when it becomes available. This covenant shall be recorded at the Barnstable County Registry of Deeds, and a copy of the executed covenant shall be submitted to the Board of Health. Throughout its life, the system shall be under an operation and maintenance agreement. The O&M agreement shall be at least 1 year and may be with any mass-certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standard of 19 milligrams shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years of testing, application can be made to the board or its agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineered site plan will be allowed without further review by the Board of Health or its agent. And this variance shall be granted pursuant to the State Environmental Code, Title V, in the Town of Chatham. Subsurface sewage disposal is valid from 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1-year period, or the variance shall expire.
Thank you, Judy. So we have a motion to approve and a second. We've read the 9 conditions. Does anybody from the public wish to comment on this application before the Board of Health proceeds? If not, any final comments or questions from any board members on the application? If not, I'll call the question. All in favor of the motion, say aye. Aye.
Aye?
Any opposed? Hearing none, the motion carries and the application is granted. So you're good to go, Mr. Riley. Okay, let's go down to the next agenda item, which is a variance hearing and approval of IA Technology for Paul and Jania Matherwitz at 209 Barcliff Avenue. Representing this application is Clark Engineering. Mr. Clark, you on the call?
Yes, I am. How are you all today?
Doing fine.
Good. David Clark, Clark Engineering on behalf of the Matherwitzes. This is an existing 2-bedroom house on Barcliff Avenue on a lot that is fairly small. They would like to tear the house down and build a new 3-bedroom dwelling. So we're here before you for the required variance for the 1-bedroom. As per your regulations, we're providing treatment in the form of a singular system that will reduce the nitrogen so that the 3-bedroom house with treatment will introduce less nitrogen than the 2 bedrooms without. We also submitted copies of the floor plans. I think it's pretty straightforward. We have no bedrooms on the first floor, 3 bedrooms on the second floor, and there's also a common area den with a 5-foot framed opening on the second floor. So I'd be happy to answer questions.
Oh,
This is where you go mute, so we're not.
here.
Yes, but that's when you're ready, and then
Thank you.
over here, and this is your video. You can turn your
Do we have any questions or comments from any Board of Health members on this application? We do have a memo of recommendation from the health agent that we approve this, and Judy has listed 9 conditions that she would recommend be appended to the motion if we choose to approve. Can we have those read? Oh, actually, let me start with, can I get a motion to approve this? Have an approval. Can I get a second?
Noble, second?
Noble, second. Okay, we have a motion to approve. We have a second. Judy, can you please read the conditions?
So it's the same as the last time. Number 1, the applicant should restrict this property to a maximum of 3 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction to the Health Division. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and/or Board of Water and Sewer Commissioners, directs the connection of this property to the municipal sewer when it becomes available. This covenant shall be recorded at the Barnstable County Registry of Deeds, and a copy of the executed covenant submitted to the Board of Health. Throughout its life, the system shall be under an operation and maintenance agreement. The O&M agreement shall be at least 1 year and may be with any Mass certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standard of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with a semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and evaluation made by the operator within 30 days. After the required 2 years testing, application can be made to the board or its agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineered site plan will be allowed without further review by the Board of Health or its agent. This variance is granted pursuant to the State Environmental Code, Title V of the Town of Chatham, subsurface sewage regulations, and is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1 year period, or the variance shall expire.
Thank you, Judy. Does anybody from the public on the call at present wish to comment on this application before the Board of Health proceeds? Hearing none. Any final comments or questions from any Board of Health members on this? Okay. I'll call the question. All in favor of the motion as made and approved and the conditions as read into the record, say aye. Aye. Any opposed? Hearing none, the motion carries and the application is approved.
Thank you very much.
You're welcome, Dave. All right, let's move on to item. Okay. All right, good. Thank you. All right, the third agenda item is a discussion of the draft environmental assessment for Chatham Municipal Airport that was included in our packet of information that all board members received. Dr. Duncanson, are you going to begin the introduction of this topic?
Sure, I'd be happy to. So, as the board's aware, the airport has been working on an update to their airport master plan for a number of years now. One component of that is the airport environmental assessment, which was dated April 2021, which was included as part of your packet. That document was out for public review and comment, and the public comment period ended, I believe, on July 6th. There had been a number of comments received at the Health Division and by myself, which have been all forwarded over to the board, asking the board to review and weigh in on the environmental assessment. Many of them tied to EPA, the Environmental Protection Agency's comment letter of July 6th, to the Federal Aviation Administration, where EPA pointed out a number of topics that they would like to see addressed in the next draft of the environmental assessment. And they basically identified 5 or 6 areas tied to aquifer protection, public drinking water in terms of the wellhead protection areas, the spill prevention, control, and countermeasures plan, stormwater management, and then the underground injection control program. And those were all items that EPA indicated should be addressed as part of the environmental assessment. I have spoken to the town staffer, who's the airport liaison. Those comments will be addressed in the next version of the draft statement, in the next version of the environmental assessment, along with any other public comments that have been received. I reviewed EPA's letter. Most of their comments just have to do with missing information in the environmental assessment. Most of this is information that the town or the airport already has in their purview, if you will. And it's just a question of getting that documentation into the draft environmental assessment. So with that, I think it's up to you. You did receive some comments directly to the board from members of the public. And so I think that's what I have for you at the moment.
Okay, thank you, Dr. Bob. I read with interest after I got towards the end of this letter. In the second to last paragraph, the letter writer from the EPA says, the EPA does not believe that the Chatham Municipal Airport project described in the draft EA will pose a significant threat of groundwater contamination, which could cause a health hazard. So I think that's important to bear in mind, is that that is the one of the final concluding comments in this letter of comment. And although the letter does raise questions about additional information being necessary, and I think those are well placed, and hearing Dr. Duncanson say that the airport will be responding to those questions in kind as part of their next version or the next draft of their EA, I'm satisfied that the process is moving as it needs to move and should move. When I read that the airport is planning to do certain projects in the future, Bob, am I correct in assuming that part of those projects include additional hangars, right? And part of the projects include pruning trees and revising vegetation barriers and such. But there's nothing else that I picked up on from an environmental perspective. I noticed something about a future fuel holding plan, but that was mentioned as being not something imminent. Can you comment on that?
Yeah, that's correct. They are proposing new hangars. They are proposing additional tree clearing. They are proposing a future fuel upgrade, if you will. They upgraded the fuel tanks a number of years ago. They did previously have underground tanks. They moved those above ground when regulations changed, and the tanks needed to be replaced. So yeah, this is a plan. It does not mean the construction of all these things is immediately imminent. They have to lay out these plans every so many years for FAA and Mass Aeronautics, and so that's the exercise that they're currently going through, is to put it all down on paper so everybody knows potentially what is coming in future years, if you will. And then they pick particular projects in a particular year and seek local, state, and federal funding for that. Generally, the Federal Aviation side of it will pick up 90% of the cost. The State Aeronautics Commission picks up 5%, and the town picks up 5%. That's generally how it works. So yeah, it's not to say that all these projects are going to happen next year. That's not the way it's done.
And a BMT is a best management practice. I figured that out
Yes.
after
Yes.
getting into the report a little bit.
Yep.
Other board members? Dick?
Well, the question I have is, what is the role of the Board of Health in the airport management plan? We have a Water and Sewer Commission that's responsible for the purity and safety of the water. I would think that if they felt they needed some expertise from the Board of Health, they could ask us. But for the Board of Health to get involved in overseeing the airport plan doesn't seem appropriate to me at this stage. I mean, we weren't even involved in the decisions regarding how to manage well number 5 when we knew there was some PFAS in it. They said, well, that's the Water and Sewer Commission's responsibility. And then people are sending us letters saying, well, we'd like the Board of Health to get involved in the airport management plan, and I don't really see that that's significant and that we should do that.
Okay. Other comments?
No, well, I had a couple quick questions. Is it in the plan to make a new fuel depot? Is that part of the plan? Because that's one issue that they raised.
Yeah, I believe there is a plan in the future for a new fuel depot, yes.
Okay, so the EPA has asked for more information about that.
Yep.
And is there underground injection in the plan? I don't think so. I think I read-
There are no longer any underground injection control points. There were some, we did a study, 10, 15, 20 years ago now. Because under the state's definition of underground injection control points, it can be as simple as floor drains inside a building. And there were some floor drains inside some of the airport buildings years ago. As part of an UIC, an underground injection control program work that was done. Those were all evaluated, they were studied, test borings were taken at those points just to see if over the decades anything had been disposed of. So that study was done, and that's why I say there's a lot of what EPA raised here has been done. Those reports just didn't necessarily, that information didn't translate over into this report. And I think EPA was just highlighting the fact that if there are any of those things, they should be addressed as part of the environmental assessment report. And like I say, from my recollection, most of what EPA has identified here is available information. It just needs to get into this report. EPA talks about a groundwater contour map. That was done before, but it's not in here now, but it can easily be brought over and put in this report to address a lot of the questions that EPA, or not questions, but a lot of the issues that EPA raised.
Yeah, okay. And then, is Mr. Temple involved on one of the inside people in all these discussions, like you are, I guess, but, because there's one mention that he should be.
Tom Temple is the DPW director.
Right.
He doesn't have any direct role in terms of managing the airport. I think if I remember right, that comment was in the vein of,
It said
groundwater and
coordination
stormwater
with
protection.
Chatham Water District, and they have Mr. Temple's name. They may not have the right person there, but.
Yeah, well, Tom is DPW director. Water and sewer is part of DPW. Yeah. Yeah.
Okay. Yeah, so I would say that we're not in the sort of the chain of command here in terms of this thing, is the Board of Health, but it is the single source aquifer, which is, you can say has to do with public health.
Right.
And I don't think we're gonna I wouldn't recommend that we get in the position of making orders or directing anything, but I would say, having read the EPA's evaluation, that we should consider supporting, and it sounds like it's gonna happen anyway, but supporting that Gale and the Airport Commission, fully respond to all the recommendations, and I get like 6 or 7 here, and if they ask for a plan, put a plan, but that we support, a full response to all the EPA recommendations, and we look forward, to hearing what the response is. Not that we're gonna get in the middle and start trying to direct things, but I think that's reasonable from my standpoint.
Right.
A little different from what Dick said, maybe.
Well, let me clarify something. I asked that this be put on the agenda because I felt that once we started hearing from members of the public encouraging that the Board of Health get involved, that we owed it to ourselves to at least understand what was going on. And I think tonight is doing that, at least for me. It's giving me a context to understand what this is about, who the players are, and to begin to get a feel for it. But I concur with Dick completely that I don't think this is an issue that this Board of Health wants to get involved in great detail with. I would rather just periodically monitor how it's moving along, and if we have a reason a public health-based reason to get involved or recommend something, that we speak up. But otherwise, we allow the process. It sounds to me like everything that's happening is fine, is orderly, and that we just kind of stand off and stay in touch with it, but allow the parties that are involved in this to do what they're supposed to do. I don't know if I said that properly, but if there's support on this board for Noble's recommendation that we convey, a recommendation that the process continue, I would be fine with that. But Ron, what do other board members think?
Yeah, I have a few questions about it because I've
Okay.
been on the board for quite a while. And one of the things. Is it off now? One of the things that really concerned me back when we had the discussion, and I went to a lot of those meetings, was number one, there's a tank truck that travels around there that's full of fuel. No one knows where it goes, where it's parked, okay? And I think that's a problem. It could be in one of the hangars and be leaking, and probably no one would know if no one knows where the truck is. We asked the people, we asked the manager up there, no answer to it. And I don't know if Bob or anyone else remembers that. The other thing is that my concern is these new tanks double-lined? And if they're not, why not? Why are they double-lined? And the part about us getting involved, this is our drinking water that we're talking about. If we lose our drinking water, we might as well forget about Chatham, just close up the doors and go home. Because I think that the Board of Health should stay in touch with it and involved in it. Okay?
To what degree do you think?
I think we should be right involved with it. It's town water that's being questioned here.
So are you okay with what we're doing now, which is to stay in the loop and understanding?
I think,
what's
you know,
going
with
on and
what
being updated by Dr. Duncanson when additional progress is made?
No, it upset me very much when I saw these letters that came in from other people questioning it, okay? They mentioned what went on in front of the board of, the select board, comments that were made and things that went on there. You know, they show them, and I do know both of these people. I don't know them, they're not friends or anything, but I do know who they are. And they do their homework, and they have a lot to say, and I agree that if we lose our water, we're a problem, and I think that comes under the Board of Health. I don't think we can bypass that point. We should be in charge of the water.
So the Water and Sewer Commission should take direction from us, is what you're saying?
If it comes to the.
Although the Water and Sewer Commission's
Yeah, I
purview is to ensure safe water,
Yeah.
the Board of Health, you feel, should trump the Water and Sewer Commission.
I feel that we should be involved in that, yeah. If something happens, we're right there
Well,
and we know what happens. Because obviously, something's going on here. I know Bob's done a lot of talking and about the, what's gonna be, what he's gonna check on and do all of that, and I'm sure. But I think the Board of Health still should be a voice in this.
Yeah, I agree with what John's saying. We don't want to get in the position of trying to direct this thing or get in the middle of different factions in the town. And it sounds from what Bob says, that a lot of this is going to happen answering these questions. And so I'm not saying we should, jump in and start taking control, but I do think it would be helpful for us just to, and we've done it in other cases, just express a recommendation. Sounds like it's going to happen anyway, but just that we recommend that Gail and the Airport Commission fully respond to all the recommendations in this EPA and get into the fuel depot. We're not getting in the middle of it. We're just saying what is probably going to happen anyway, and which is pretty logical. But that, that shows that we support a lot of the townspeople that have concerns without, I would think, without getting into the middle of the different factions and all
I
that.
assume
It's just a recommendation to fully answer all the recommendations, which they're probably going to do anyway, so it's not a big step. But I think it shows that we're
Engaged.
concerned and we're watching, we're engaged, we'll get the answers back, we'll take it meeting by meeting, not get
Can I
heavy-handed.
assume that was a motion?
if people don't
No, I'm still concerned about, I think the Board of Health should be right there involved in the drinking water of this town.
Well, I think that if,
We are by virtue of having an interest in
We have
following
an interest,
this
is
process.
having an interest, because, I mean, everybody in town has an interest in it. All these
Well,
people that wrote letters have an
Ron,
interest
if
in it.
we come across something here that gets us very concerned, we will speak out, I'm confident. But for right now, at least my perspective is, I think there's a process here that we have to allow to unfold and stay in touch with where it's going. And hopefully everything will resolve amicably and with approvals.
This-
So,
This has been a long problem. I mean, just take, for example, the tank truck full of gasoline, petroleum up there. Bob, do you know where it is?
It's either stored inside the old hangar area or it's outside. It's either, I believe it's stored inside the old hangar building, which is the original
No.
part of the airport.
Is there protection on the floor in there if it ever got a
Well,
leak?
one of the things we did was we closed the floor drains that were in that building. That was part of the UIC program years ago. We closed those all up. So if there was a spill, and they have a spill control and prevention plan as part of the airport operations. They've had
Yes.
one for years now because they're required to. They've had it. So they've taken all the appropriate steps, you know, that obviously if a meteor comes down and hits the building and the truck, that's outside the realm. But in terms of all the other steps, they are fully in compliant. They are fully compliant with all the rules and regulations.
Well, I just remembered, I'm sure you remember, the big question on where was it?
Yeah.
And nothing, they never was told where it was, and that created a lot of,
does it go out on the tarmac and fill the planes? But,
Occasionally it does, but most of the planes are filled right from the little fuel depot they have.
okay.
and are the tanks, the new tanks out there, are they lined, double lined?
I believe they are. If they're not, they're the concrete encased tanks. Remember, you can have two different types. You can either have double walls or you can have concrete encased. But they're fully in compliant. They have 125% capacity of tank in the containment area. So if there was a leak, that's why we took the underground tanks out and put the above ground tank to make sure it was, when it had to be replaced, it was compliant with the regulations.
Now, does any part of that airport go into the safe zones, the water, you know?
That the airport is within the zone 2 for the Indian Hill well and maybe 5 and 8. I'm not sure I have the.
I tried to look through here, but it's kind of hard to.
Yeah, and that's one of the things that EPA identified was missing, was they were looking for the groundwater protection district map, which, you know, we have, and so it's just a question of taking that map and putting it in here with whatever appropriate narrative is possible. What I would suggest, listening to your conversation, is two things. One, I don't disagree with what Noble proposed in terms of sending a letter, just reiterating the board's desire to see all of EPA's comments addressed in a timely fashion in the next draft. And then obviously, when the next draft is available, we will make sure that the board gets that, so you can review for yourself and see if all the EPA topics have been adequately addressed, as well as any topics brought up by members of the community to the board. You know, I think that's where it belongs. It belongs with Gale Associates and the Airport Commission, who developed this report. But I think it's perfectly your role to say, yeah, these things have been addressed, or wait a minute, we don't think you've adequately addressed number whatever, or this particular comment, and we want to see that, you know, we want to see that readdressed, if you will.
yeah, this is Noble, I agree with the way Bob framed it, and I think it goes along with what Ron's thinking, and that we get more information, and we're gonna review it, and we're sort of a part of the process, but we're not directing
Well,
it.
it concerns me that it's that close to some of our wells.
Sure.
And, you know, and that some type of real protection should be taken on that. And I went through all those meetings that they had with the commission, the airport commission, and a lot of questions didn't get answered for the public there. And this has stemmed Bob will remember all that, and it's been a real problem. And I'm just
I
concerned
think-
about our well water. And
Yeah, I think if we make a recommendation that that Gail and the Airport Commission fully respond to all the EPA recommendations and concerns in this letter, that throws our support with the people that are concerned about things and with people writing letters. You know, it gives them a chance to get more information, and I think it'll help the whole process.
Can I consider that a motion, Noble?
Sure.
Okay, can I get a second on what Noble just said?
Basically, we'd be, what Bob said, and, yeah. And then Judy and Diane can put all those specific.
Can I ask a question?
Yes.
Bob, I'm assuming the EPA will review the next draft and come out with a new list of comments or not. They may say they've addressed everything and they're happy. And then I think it is important that the Board of Health be copied on the next draft, hopefully. And that is it within your purview as you were discussing it
Right.
today.
In the EPA letter, it's not under a recommendation, but in the last paragraph, it brings up this whole issue of a new fuel depot, and I'm assuming that something's gonna change. They have a new tank or something which you can construe as a new fuel depot, and that would put the onus on them to explain just what they're doing and all the safeguards, which would
Right.
help Ron.
They'd have to comply with all the federal standards, the then federal standards.
One of the problems up at that airport is that the size of planes that are coming in are larger, okay? Almost small jets going in and out. They come right down my street, and I see them all the time. There's some small jets that go in and out of there, which there wasn't supposed to be, but they're in now.
But how do you know that, what you just said? It
I
wasn't,
can
it
see
wasn't
'em when they fly-
supposed to be.
I can see them when they fly over. They're small jets.
But how do you know they were not supposed to be?
It's not, that's not, the airport's setup was not to be a transfer of people, okay? It's flying people in from other state, from New York, basically.
No,
This all came out.
I guess you
this all
made a
came out at the
statement,
meetings.
Ron, that it's not supposed to have small jets, but do we know for a fact that,
It is supposed to be a small residential airport.
but they must be allowed to do it because they're doing it, and they have to comply with all the FAA requirements now, Dick?
Somewhere in this document, it said it's a level B1 airport, and it has a limit on the number of propeller planes that can take off, and you can have 700 jet landings a year, 2 a day, under the regulations according to the way this airport is
Okay.
set up. If that weren't allowed, then it would be in violation of the FAA regulations. The airport would lose all federal funding.
Right.
So if a jet wants to land, a jet can land, but there shouldn't be more than 700 a year.
Okay.
I don't know where, there's a big turboprop that comes in every Friday and brings people in, and it leaves every Sunday. Now, that's a propeller plane, so I think that is considered a propeller plane.
Mm-hmm.
You know, and so I don't think that's it, because that definitely comes in frequently. But
So-
again, there are regulations for this size airport, and I believe this airport must be within those regulations.
Okay.
Now, I can remember back them saying that there was not to be a public airport landing in all those meetings they went on.
There's clearly a lot of people in Chatham who are not happy about the way the airport is progressing and enlarging and the increased number of business, but that's not the purview of the Board of Health, I don't believe.
Yes.
The water is.
Yeah, so there's no, so I would put forward the motion as Bob framed it, and we're addressing then the single source aquifer of the town and how the EPA has made recommendations that impact on that, which I think kind of falls under our purview.
Yep.
But not getting into the business of directing things. So I'll put that forward as a motion, and,
And that we be copied on the next,
yeah, we'd be copied, and then
Future
keep it,
correspondence.
Each meeting we would review.
okay. Can I get a second on that? Anybody care to second that motion?
Well, if I can second it, I would second it. I don't know, do we have a quorum? Am I included?
We have a quorum, but is Dick as an alternate allowed to make a motion if we have a quorum beside him? I'm not sure.
What would anybody else like to second it?
Can I second it as the chair? I'll second the motion so we can get it voted on. All in favor of the motion?
Do we have people, I think we have people that may.
Yeah.
Okay.
We do have people
Does
that.
anybody from the public wish to comment on this motion before we vote on it? Should have asked that beforehand. Anybody? Somebody, you're muted. We can't hear you. That's Debbie, okay.
Debbie, you're muted.
We-
There.
Okay,
There we go.
start again, Debbie.
Well, first thing I wanted to say, thank you so much for the full discussion that you've just had on this. I really appreciate hearing your discussion of it and respect what you've had to say. I do want to address what your chairman opened with, however, and that is that he read the second half of a sentence without reading the first half. The first half of that sentence, which he quoted saying, EPA does not believe that the Chatham Airport will pose a significant threat. The first half of the sentence is provided that the project meets all applicable federal, state, and local environmental protection standards, then EPA has no problem with it. So I think that the fact that local standards is in here and that the approval is conditional is an important point for your board to consider. I think the resolution that you're discussing, which is the letter that Mr. Duncanson proposed, is a wise way to proceed. And I support, and I would personally thank you for doing that. Thank you.
Thank you, Debbie. Any other comments from the community? Yes, we do need to weigh in, because that relates to this issue.
Yes. well,
Okay.
So we did have several comments that were sent to us, and one was specifically asked that I read it into the meeting. And it was to chairperson and members of the Chatham Board of Health from Gloria Freeman, dated July 30th, 2021. I'm asking that this correspondence be read into the record. I am writing to respectfully request that the Board of Health members be personally involved in the study that the Select Board have commissioned to determine the cause of PFAS in our drinking water. You have primary responsibility for protecting and improving public health and well-being of the Chatham community, and of course understand that our drinking water source protection is critical to townspeople's health and economic stability. According to the town website, your responsibilities also include environmental compliance, investigation, and enforcement, so this request is a reasonable one. Townspeople are grateful that our select board has requested a study to determine the cause of PFAS. However, the study is currently limited to wells 4, 5, and 8 and land use in those areas. In order to ensure clean drinking water for the present and future, the select board members have been asked by others and myself to expand the study of the scope of this study to include all potential sources of water contamination within the entire water resource protection district. We've also asked the select board and town manager to ensure an independent study, not one conducted in-house by Weston and Sampson, the entity responsible for our water system. An outside consultant would ensure greater transparency, accountability, and trust. The DEP, the Department of Environmental Protection, has alerted us to potential critical problems at our Chatham Airport, July 6, 2021, and has made demands for additional information and action relating to the airport's environmental assessment. Our Select Board and Board of Health should ensure that those issues be carefully investigated for current and future potential problems, especially with any expansion of use at the airport. This document, as well as the 2003 Mass Department of Environmental Protection Source Water Assessment and Protection Report for the Chatham Water Department, provides sufficient information for the Select Board study to be extended beyond PFAS contamination and beyond 3 wells. It is important that citizen and local officials work together to protect our drinking water sources in an effort to safeguard public health and economic stability, as well as to prevent contamination, which causes costly water supply cleanup and remediation. Thank you for your consideration to join in the discussion of the issue, which is so critically important to Chatham.
Thank you, Judy. We thank Gloria Freeman for taking the time to write that. We have a motion on the table to proceed with a letter, as outlined in the motion from Noble. All in favor of that motion, say aye. Aye.
Aye.
Any opposed? We have one nay. So we have 3 plus 1, 4, and one nay. So the motion carries. Okay? Now, that's issue number 3. Hearing item number 3. Bob, Dr. Duncanson, we have a need for a COVID-19 update with you, and I don't know quite how to work in the PFAS question other than to ask you to comment as you think we should, and there may be no new updates on PFAS. If you would like to comment on the recommendation from the letter writer that the scope of the study be expanded, you certainly can, but there's no requirement at this time that you do that either, so.
Okay, well, thanks, John. Well, let me start off with the PFAS, because that should be a relatively short update. I'm sure the board saw the figures that were sent out at the Lex Board of Selectmen meeting. If not, I can resend those to you. They just completed the most recent quarterly sampling for PFAS in all the town's wells. Remember, starting in April of this year, the town is required to sample quarterly based on the new state drinking water regulations, and it went into effect last October. April was the first quarterly sampling, and then we just did the July quarterly sampling. There was no PFAS detected in wells, the South Chatham wells, which is wells 1, 2, and 3. And that was a sample taken after the 3 wells were basically combined together. So that was non-detect. And there was also non-detective PFAS in wells 6, 7, and 9 based on a sample of the outflow from the new water treatment plant. Rather than sampling each of those wells individually, because they are all combined together, either at the treatment plant or in the South Chatham well field, they're sampled in the aggregate. If that sample were to come out positive, then we would go back and sample the 3 wells individually to see which one was causing the problem. But luckily, those 6 all came out negative. Wells 4, 5, and 8 continued to show low levels of PFAS. And so as a result, as you know, well 5 that was the one that had the highest levels of PFAS in it. That well has been offline since April, since the initial detect. Well number 4, as you probably recall, or at least some of you may have been here a while, well number 4 has been offline since the 1990s. When originally that well had detectable levels of PCE, or tetrachloroethylene, in it. There was an extensive study done back then to look at well 4 and potential sources of contamination for the PCE. We think we found the source, but never definitively, because PCE was a chemical that had been used for many, many years. And I can tell you it was not the airport, if that will satisfy you in any way or form. But we do think we found the source of the PCE. And so that well was shut down when it was first detected. And then over time, the levels did come below the state standard at the time, but the community still said, we don't want anything put in our well, so the well has remained offline since then. It has not been abandoned as a public water supply well. It has been maintained all these years. Regular testing has been done under DEP requirements, but so that well is there. So so the town is basically working on 3 tracks at the moment. One track is we have Weston and Sampson looking at what treatment will be needed for wells 5 and 8 to deal with the PFAS issue there. However, it is going to require iron and manganese treatment beforehand. That's not unusual. That's what we put in place down in South Chatham at the water treatment plant, was iron and manganese removal. So we are going to have to put iron and manganese removal in place at wells 5 and 8 as a precursor to PFAS removal. So basically, you take out the iron and manganese, then you can use granular activated carbon to remove the PFAS. If you don't do that, you would clog up the GAC too quickly, basically rendering it ineffective. So that is moving forward. We are also moving forward on a source detection study, for want of a better term, but looking at potentially where the PFAS in wells 4, 5, and 8 may be coming from. We've got a draft scope of work for that. The town manager and I actually had a meeting this afternoon with a private entity that does that kind of work. So that is going to be moving forward here in the not too distant future. The extent of that, whether it is going to simply be the zones of contribution to well 4, 5, and 8, or will include other areas of town, remains to be seen at this point. Obviously, we had a lot of comments that you discussed tonight about expanding the scope of that. However, I think now that we have 2 rounds of testing for the South Chatham wells, as well as the town forest wells that are both negative, it really comes down to how much time and effort do you want to propose looking at other areas of town where apparently we don't have an issue. So that is still up for discussion. And then the third leg of the stool with regard to PFAS is we're looking at bringing well number 4 back online. And so the town, working with Weston and Sampson, is moving forward with, in order to bring well 4 online, we'd have to put chemical treatment in place because it currently has none. We would put chemical treatment in place for disinfection as well as pH control, which is not unusual because, if you know, the Cape's water is naturally acidic because of the underlying bedrock. So the engineers are currently working on the designs and the permitting to bring that online. We had hoped that it would be online sometime this month, but now it's looking more and more like September. And the reason for that is simply COVID-19. A lot of the materials and equipment that we would need are in short supply and are backlogged with vendors and suppliers. So it's not that, things can't move quickly. It's just some of the components we can't get right now in a quick fashion. So it's looking more and more like well number 4 would be back online sometime in September, after DEP approves it, and also after the Water and Sewer Commissioners, aka the Select Board, approve it, because we said we would come back to them, or the town would come back to them before that well came back online and back into the distribution system. So there'll be more to come on that over the next couple of weeks. So that's kind of a quick synopsis, if you wouldn't. Sorry, it wasn't very quick, but a synopsis of where we are on the PFAS issue.
4 would be brought back because we need it?
4 was being brought back online, yes, and as a safety precaution. Well number 5 has been offline since April. We are in the midst of a drought, as you know. Groundwater levels are exceedingly low, and so there's been 2 concerns. One, as we, without well 5, that means we pump all the other wells more. And we were getting very close to the industry standard recommendation of not pumping your wells more than 16 to 18 hours a day.
Okay.
You don't want to pump your wells 24 hours a day because A, it's taxing on the equipment, and it also doesn't give the groundwater a chance to kind of flow back in to the cone of depression.
Right.
So we were getting very concerned about that with well 5 offline. The other thing is we've been keeping a close eye on the water storage tanks. And there were, when they get below about 80%, that's worrisome for fire protection reasons and all. You don't get as much pressure behind the water. And even though last week was relatively cool and damp, we did have that 80% threshold one time over the weekend, and we actually hit it again this morning. So we just would like to have well number 4 available if we need it to pump the tank up again, or if, God forbid, we lose another well for some other reason, because it draws down too low and gets to the screen where it automatically shuts off, or, there was some kind of a spill condition on a passing road or something.
Yep.
We just wanted to have well number 4 available.
Thank you.
Just a couple of quick questions. You said 4, 5, and 8 have low levels. Is that below the state critical level?
Right now, the MCL for PFAS is 20 parts per trillion. Based on the results, based on the number of samples that have been taken, well number 5 is right at 20. Wells 4 and 8 have been average. Their average is about between 8 and 10. So they are below the MCL.
Pretty low. And then sort of a corollary, just quickly, is there any thinking as to why the levels fluctuate? Because you'd think if this stuff is in the ground and it's, it would just be there, but it seems to have gone away.
That's
you may
one
have
of the
given answer.
questions we're going to be having consultants look at. There was a lot of variability in well 5. The first sample out of well 5 came in back in April, came in at 28. It then went up into the upper 30s. It then went up into the 56.6, and then it dropped back down again. Now, one of the working hypotheses that I have is as soon as we got that high level in well 5, we shut it off, and so we then shrank the capture zone, if you will. And then when we continued to sample well number 5, it was off. We were just turning it on long enough to take the samples. So it wasn't drawing from the outer reaches of its zone 2, if you will. So I'm wondering if that may account for why well 5 has dropped off. And if we were to bring well 5 back online and run it, 7 days a week, 15 hours a day, and we start increasing that capture zone, would we start picking up a source of PFAS somewhere?
It suggests that the source is not close to the well, but
It
further out.
Somewhat suggests that, yes. But, until we get more data and do some groundwater modeling and whatnot, which we're planning to do as part of this assessment, it's conjecture on my part.
But monitoring
that
is,
makes sense.
so the additional work, the source detection study is going to involve putting in some monitoring wells in other strategic
It
locations?
may or may not. There's already a fair number of monitoring wells in the
Okay.
area because
All right.
before you put a new public water supply well in, you do put a number of monitoring wells in the ground. So there are monitoring wells there. We put monitoring wells as part of the airport work a number of years ago. So there's already some monitoring wells around the airport.
Mm-hmm.
So, obviously to save time and effort, you'd like to use what you already have.
Yes.
But if we need to put more monitoring wells in particular locations, we will.
Okay,
obviously.
thank you.
Yeah.
Other questions or comments? Thank you
Okay.
very much for that report, Bob.
So quickly on COVID-19, as I'm sure everybody's aware, we are currently in a new surge both in the county and nationwide due to the Delta variant. We had 9 cases of COVID-19 in July. We had 7 cases last May. We dropped down to 2 cases in June. And for the month of July, we are back up with 9 cases. Of those 9 cases, 6 have occurred in fully vaccinated individuals. 1 case occurred in a person who was partially vaccinated, at least when they spoke to VNA. And then 2 cases we don't know about at this point yet. Because, sometimes when VNA contacts people, they don't return the calls right away or whatnot. But when I checked just before this meeting, we still had 2 individuals that we just didn't know their vaccination status. As I'm sure everybody's aware, unfortunately, Provincetown has been the poster child. They're up to over 900 cases now that were tied to the July 4th holiday period. Most of the cases seem to be the result of indoor gatherings, where people weren't masked and whatnot. The latest data out of the CDC is that the Delta variant is more contagious than the flu and the common cold. For the flu and the common cold, they generally say that one person who's positive can infect 2 to 3 more individuals. For the Delta variant, they're saying it can be as high as 8 and 9. So clearly more contagious. And clearly, you know, we are seeing breakthrough cases with fully vaccinated people that are testing positive for Delta. But keep in mind, it is still a tiny, tiny fraction, less than 1% of all the people that have been vaccinated. So, you know, even though the press and the papers make, you know, a big deal out of fully vaccinated people getting it, and it's never good to get it, it is still a substantially small fraction of the people that have received the vaccine. So vaccination is still the best way to get this under control.
Would it be safe to say that the conditions that we read about having been in play in Provincetown amounted to almost a challenge? Because if you got together a lot of vaccinated people and you really wanted to challenge their immune status, you would put them in an indoor setting with some shutters,
Yep.
and really see whether under those conditions the vaccine breaks
Yep.
would still be rare, or whether they would be much more common. And in this case, clearly, they were much more common.
Yeah, the other piece of substantial information that came out just last week was the viral load in the nasal passages of vaccinated individuals is just about the same as unvaccinated individuals. So, huh?
In the Delta.
Yeah, in the Delta, yes, in the Delta variant, sorry, yes. So again, that's just, you know, that goes along with the fact that the Delta variant is so highly transmissible. And so largely on the data that they were able to gather out of the Provincetown outbreak, that is what led to last week's change in the recommendation from CDC that even unvaccinated individuals in indoor settings that are at high risk by age or underlying medical condition should go ahead and continue to mask up. And then the state subsequently on Friday basically came out with the same recommendation. So that's why, you know, everybody's like, well, they're changing their tune. Well, more data has come out to justify changing that tune. And I did send out to the board on Friday the MMWR, the Morbidity and Mortality Weekly Report, where that specific Provincetown study was documented, if you will, and how that led to some of the thinking from CDC and from the state. So,
Do you have any idea about the 900 people in Provincetown who were positive? What percentage of those were tested because of symptoms, and what percentage are tested because of some surveillance that they did?
I do not, right offhand, I do not.
Because it's just interesting,
Yeah.
you know, that very few people go to the hospital or get really sick, but you do all this testing.
Yeah, I think a lot of this was case follow-up, you know, because every day the
Contact
numbers
test.
just kept going up as they contacted more and more people and did the contact tracing.
Yeah.
So-
Yeah.
so what
But
you
I don't
would-
have that number.
So what you would have then, a nurse investigating a case and saying, I want to know what 20 or 30 people you were around on a given night, and then getting those names, and then those people asking to be tested, many of whom may have had no symptoms, but
Right.
they
You'd
were
like
just
to
by
know
proximity.
What percentage of those 900 people had symptoms?
Right, that's a very good
May have
question.
been 10%.
It may be in the write-up.
Yeah. I didn't see it in the
Yeah.
MMWR. Yeah.
Any other,
That's a quick update. Right now, we at the local level. Sorry. Right now, we at the local level, I have had a brief conversation with the town manager on Friday. You know, we're still recommending that unvaccinated individuals coming into town, you know, wear a mask. You know, I think Chatham's situation is a little bit different than Provincetown. We don't have the large nighttime venues that pack in, you know, hundreds of people in a relatively small area. So even though, you know, Main Street Chatham may be as busy as Commercial Street in Provincetown, we haven't seen the huge rise. And I think, you know, that's primarily the reason behind it, because the vaccination demographics in Chatham are not that far off from Provincetown in terms of the number of local residents that are vaccinated. You know, our percentages are pretty high, which has been great news. But, you know, we have just as many people coming into Chatham for other areas of the country where vaccination rates aren't as high as Provincetown does. We just don't have the venues that pack them in for extended periods of
that's a
time.
very good
I
observation.
think that's so far what's
Are band
kept us from
concerts
experiencing the same
resuming?
kind of problem.
Ron?
Yeah, I had a question, Bob. They said that a lot of, like, for example, I'm fully vaccinated, but I still could pick that up.
Get closer to the mic.
Yeah.
Yeah.
I could pick it up and still give it to someone else.
Yes.
Okay. Is that a fairly common thing, or is it just?
Well, I think it's based
It's
on all
scary
the
to
data
think.
we're seeing, that's becoming more common,
Is it?
is vaccinated people are able to spread the disease just as easily as unvaccinated.
Yeah.
And that's why CDC in the state updated their guidance last week that even vaccinated people should wear a mask in the appropriate settings indoors, or if you or family members or others you're with are unvaccinated or have underlying medical
So
conditions.
this would include going to the food store, for instance, technically.
Technically, yes. And I'll tell you, from my experience over the weekend, I did definitely see a lot more people wearing masks indoors in places like food stores and other venues. So I think.
And
it's
I
getting-
also wonder what this new recommendation will mean for local merchants. Because the local merchants are going to have to ask themselves, do we want to post signage? What do we want our policy to be regarding our own employees?
Yep.
Who are vaccinated or not? So some of this is going to shake out here locally in terms of choices.
But for me, the big takeaway from Bob's numbers is that that really significant cluster they had in P-Town doesn't seem to have spread to surrounding towns. We had a little bump, but not significant, so
The
that's
only town
I don't
that's
think we
seen
would've
another
known.
bump is Truro,
Truro.
which would make sense considering its proximity.
proximity.
That's the only other town on the Cape that's seen a substantial increase that appears to be tied to the Provincetown outbreak.
So our data is really good right now,
Yeah.
and we should draw some reassurance from that. Dick?
Right, but if you look at the national numbers, the 7-day case is up to about 80,000. You know, that's like where it was last fall. and, you know,
8,000? 80,000.
80,000.
80,000, yeah.
And if it keeps going on that trajectory, we'll be up close to where we were at the worst stages of this.
But it's very.
And then the question is, are we starting band concerts this month? Do we have a
Yes.
plan for how people are going to deal with that? Because talk about having a lot of people close together. Now, outdoors is better, but you've got unvaccinated children, you've got unvaccinated adults, all in that small area. I don't know how they're gonna deal with that.
It's outdoors, Dick.
Well,
And the recommendation is for unvaccinated children and/or adults, they should be wearing a mask
Yeah.
even outdoors.
Yeah.
That hasn't changed over the months. It's only for the vaccinated people. But yeah, I mean, yeah, the situation is not getting better, and we do have some of these summertime events that are going to be starting back up again.
I would just say the other significant thing is, it's been more than 3 weeks since the 4th of July parade, and they estimated 17 to 20,000 people.
Wow.
I didn't see many masks, actually. There was a lot of festivity, and we got through that without a big surge, so who knew?
Yes. Again, that's a good indicator.
Okay.
was Delta here on the 4th of July?
I think in all likelihood it was. Yeah, I mean, they weren't necessarily doing the genomic testing as much as they are now back then, but I suspect it was here. Yeah.
Okay, thank you, sir, for that fine report, and I liked hearing the questions and comments from board members as well. We do have minutes for July 19th to review and approve. Are there any edits or comments any member would like to make on those draft minutes? Hearing none, can I get a motion to approve the minutes of July 19th?
Motion to approve, Noble?
Can I get a second? Second. Ed, second. All in favor of approving the minutes of July 19th, say aye. Aye. Any opposed? Hearing none, I don't. Motion carries unanimously. Any other final thoughts or comments or issues anybody would like to raise before we adjourn? If not, can I have a motion to adjourn?
Motion to adjourn.
Ron, thank you. Second?
Second, Noble?
Noble. All in favor of adjourning, say aye. Aye.
Aye.
Any opposed? None. Motion passes to adjourn. Thank you, everyone, for the meeting.